Thank you very much, and thanks for the opportunity to come and talk here today. I feel like my job's been done in some of the previous talks today, and I'm very happy, therefore, to skip over some of these things. What I did in preparing today was to look at the Meadowbrook master plan and look at particularly the SWOT analysis that had been done. For this talk, I've taken out the weaknesses and threats because I want to focus on the opportunities that I think we have and also some of the challenges, but I will come back to what I think some of the weaknesses and threats are in my last slide. Just a few facts and figures about Griffith and what the health group at Griffith can bring to this partnership. It already brings many of these things. You've already just heard about some of the programs, the nationally accredited programs that we run out of the health group. Our schools are spread across all 5 campuses, particularly on this campus, of course, as well, with a growing presence of our health programs at the Nathan campus just down the road. Our expertise spans from the biomedical through to the clinical and social sciences and public health. And last year we had over 13,000 students enrolled in the health group. So we're a sizable health faculty now. We can't educate our students unless we do it in partnership. And we already have very, very strong partnerships across this area, particularly with Metro South and the Logan Hospital. And we want to build on those partnerships. And the reason why we can't do it without partnerships are those figures there about offering students our practical placements in clinical education. And we partner with over 1,000 agencies in order to do that. You understand why that's necessary when you see our students complete almost 250,000 days of clinical education as part of their programs across all of those disciplines. That's almost 2 million hours if you want to work it out across the group. We also employ a number of conjointly appointed staff with various hospital and health services, including in this area. We have a vibrant research program, as you just mentioned, the Menzies Health Institute Queensland. It's only a couple of years old, but it brings together and focuses all the research that's happening within the health group, but also happening in partnership with other agencies. And the researchers in that group are organised into these 4 areas. I'm not going to talk about them. But suffice to say that three of those groups have a presence either here on the Logan campus or at the Nathan campus or in the surrounding areas. So we have a hotbed of research actually happening already. And associated with those research groups, of course, are higher degree students, more than 500 higher degree research students, and they are the future in many of the things that we're talking about. We also have a thriving clinical trials unit, which is currently based down on the Gold Coast, but takes people from a range of places. Now, Bernard's covered all of this rather nicely for me, but I did just want to point out a couple of facts, and I won't go into the national workforce. We know there's strong and growing demand, but I do want to just flick to the next slide if you need any convincing about the increase that's going to happen in the social care, in the healthcare and social assistance, and to look at how that compares to other areas. That makes the head of a health group very happy when we see that. Even though we're currently capped in terms of our growth, it makes me very happy because we know that that demand is continuing for good graduates over the next 5 years. What you've got in the health workforce is a highly skilled bunch of people. You've got a bunch of people who are at the forefront of technology, and there are huge commercial opportunities as a result when we're thinking about this health and knowledge precinct. The global health workforce is also growing, and the demand, of course, on good Australian healthcare professionals for that global health workforce is also strong. But we don't want to be losing them. We want to be keeping our very best people. We've covered off on many of the next points, but I thought it was just worth emphasising that the healthcare demand is driven by population, as Bernard talked about. It's also driven by our ageing population. In this demographic in particular, also the increasing number of children and births occurring. And what we've got coming through is an increased incidence of really quite chronic, multiple chronic conditions, driven by both longevity and also lifestyle. And they're going to present enormous challenges to our healthcare services over the coming years, and they're going to require some really innovative solutions to be able to deal with some of this. So, there's a number of challenges, and these are really well documented. Logan must be the best place for actually documenting what some of these health challenges are. And what I want to do, just in concluding, is focus on just one of them. It is my personal passion, and that's around a healthy start to life. And I want to just pull that one figure out, and I want to spend just a couple of slides talking about that. So you've already got a target in Logan, and that's to bring children in Logan into alignment with the Queensland average for developmentally vulnerable children. We know that we have many more developmentally vulnerable children in Logan, and we want to change that. And that is absolutely essential because we have to reverse this trend that your postcode will determine your future. And we know that in Australia, postcodes are determining children's futures in some of our most disadvantaged areas. So we have to reverse that trend if we're going to do these fabulous things in Logan, because they are our future. And I love this quote. It's an old quote, but it says it all. Many things we need can wait, the child cannot. Now is the time that his body, his bones are being formed, his blood is being made, his mind is being developed. We can't say tomorrow. His name is today. And I want you to hold on to that, because I now want to talk about briefly what started life as the DOHAD hypothesis. It is now real. When I first started in research, it was something that was talked about very much in hypothetical terms. And this is the concept, it's the reality now, that your future is determined in the first 1,000 days of your life, starting at conception and across the first 2 years after your birth, after you're born. Exposures to stress, to toxin, to environmental factors during those early periods, there is now no doubt it has a major impact on adult disease. We know it reprograms, it has the potential to reprogram how various organs develop and to predict your risk of having a whole range of pretty significant and chronic conditions in adulthood. We also know that for many children, once they fall behind, it's really hard to try and get them to catch up. Some do, but many don't. And we're not just talking about health here, we're talking about other social and economic predictors that are really important outcomes. And many challenges that we see in our adult populations in areas like this have their roots in early life. And I'm talking about criminality, I'm talking about problems with language and literacy and numeracy and not being fit for the workforce and therefore being able to participate economically. So I would really stress that this is something we have an opportunity to focus on, and we would be crazy if we don't focus on this in this area. So I think our strength, our opportunity and our challenge is to do things differently. We heard from Tim last night about all the other health and knowledge precincts around the country, and I think it would be a real mistake to just model what we want to do on all of those health and knowledge precincts. I've worked in Melbourne in the Parkville precinct. I've worked in precincts in the UK. I know what the foundation of some of those precincts are, and I really think we would not want to do the same thing. And I'll leave you with a quote from Albert Einstein. He always puts together the most wonderful quote, and it captures it for me very well. If you always do what you always did, you will always get what you always got. And I think that is both our challenge, but it also could be our biggest weakness and our threat if we do the same thing. Thank you.